Through the Acute Care Action Plan, Alberta is adding more than 1,000 hospital beds in Edmonton and Calgary, including new bed towers here in Edmonton, at the Grey Nuns and Misericordia, and at the South Health Campus in Calgary, which will expand regional capacity and designated surge spaces that can be activated during high demand periods like respiratory virus season. We've also announced the site for the standalone Stollery Children's Hospital, and we continue to build the Red Deer Regional Hospital expansion. The front end of the hospital system, we're trying to divert people to the most appropriate level of care. So whether that's an emergency department, an urgent care center, or perhaps they could be cared for in their home or community. Perhaps someone presenting to an emergency department could be immediately diverted to recovery or mental health supports outside of an emergency department, or they could be redirected to social supports. In hospital, we're trying to improve flow. And so we're looking at our processes, we're trying to standardize, we're trying to leverage best practices from site to site and enhance the type of coordination that we have really done throughout respiratory virus season. And on the back end, which you've heard a lot about, is we're trying to decant the hospital of alternate level of care patients. So on any given day, we have 12 or 1,300 alternate level of care patients in hospital beds. About a quarter of those are awaiting placement in continuing care. The quicker that we move them to the more appropriate space, the faster we have a hospital bed for someone who requires acute care.